We are the only HBCU west of the Mississippi. We are actually a historically Black graduate institution, otherwise known as an HGBI. We are the only dually designated HGBI and charter member of Hispanic serving institutions. We are the only health professions university named after a physician, Dr. Charles Richard Drew, who we give honor to as a brilliant African-American physician famous for his pioneering work in blood preservation during World War II. The university and its emphasis on service to the community, we continue to draw inspiration from Dr. Drew. I should note that we will be celebrating our 50th anniversary next August. We just turned 49 on August 3rd of this year, and we are happy to continue Dr. Drew's legacy through the education and training of physicians, physician assistants, soon to be as we will reopen our PA program in fall of 2016, nurses, and a variety of other allied health providers who are dedicated to service in underserved communities. Our mission is to develop a diverse group of health professional leaders who seek social justice, promote wellness, provide care with excellence and compassion, and are uniquely qualified to transform the health of underserved populations through outstanding research and clinical services in the context of community engagement. Our mission, again, is achieved by educating nearly 700 students annually who represent our College of Medicine, our College of Science and Health, and our most recent addition, the Mervyn M. Dimely School of Nursing. We provide high-quality research on health disparities, and in my humble opinion, we are indeed a hidden gem, one whose mission inspires me daily and that I could talk about for at least an hour, but you all know Dr. Friedman is a stickler, so I'll stick to the point. Your focus today will be to learn and hear about cutting-edge research on substance abuse and addiction, to foster and support research experiences for students and residents who attend Charles Drew and other institutions, as well as to facilitate independent drug addiction and substance abuse research. I know personally that drug addiction research is understudied, underfunded, and that the drug and substance abuse use disorder is and will be in high demand in order to meet the challenges associated with increased health insurance and access to health services. I meant the drug and substance use disorder workforce. In fact, it makes no sense to me that Obamacare continues to be fought, appealed, frowned upon, but I take solace in the Supreme Court's decision that allows Obamacare to continue to be implemented in this country, to continue to provide opportunities for health access to those folks that come from underserved, underrepresented, and under-resourced communities. Obamacare, in other words, has staying power, and your role in research and the provision of services and treatment for those who suffer drug and substance abuse addictions is an important one. In fact, I would say it is imperative. As I close my welcoming remarks, I hope that as researchers, counselors, educators, and others in the field, you will also take on an advocacy and public policy role to inform local, state, federal, national, legislative, and congressional leadership of your findings in this work that is most important to underserved, under-resourced, and underrepresented communities. It will help to address the issues and reduce the resultant disparities that exist with access to drug, alcohol, and other substance disorders. We know these disorders disproportionately impact underserved communities like ours, as well as underserved communities that are in rural and other suburban areas throughout California and the nation. Again, I thank you for coming to CDU, for your support of this symposium, and most importantly, for your research on this very important subject. I can honestly say that your work is personal to me, to my family, to my community, and I suspect many people in this audience. Have a very great day and conference.